The mosquito that carries the Zika virus is found worldwide. The Zika virus is most often spread to people through mosquito bites, primarily in tropical and subtropical areas of the world. Infection with the Zika virus is also called Zika, Zika fever, or Zika virus disease. Researchers are working on a vaccine for the Zika virus. As many as 4 out of 5 people infected with the Zika virus have no signs or symptoms. When symptoms do occur, they usually begin 2 to 14 days after a person is bitten by an infected mosquito. Symptoms usually last about a week, and most people recover fully. Signs and symptoms of the Zika virus most commonly include mild fever, rash, joint pain, particularly in the hands or feet, red eyes, conjunctivitis. Other signs and symptoms may include muscle pain, headache, eye pain, fatigue or a general feeling of discomfort, abdominal pain. See your doctor if you think you or a family member may have the Zika virus, especially if you have recently traveled to an area where there's an ongoing outbreak. The U.S. Centers for Disease Control and Prevention, CDC, has blood tests to look for the Zika virus and other viruses spread by mosquitoes. If you're pregnant and have recently traveled to an area where the Zika virus is common, ask your doctor whether you should be tested, even if you don't have symptoms. The Zika virus is most often spread to a person through the bite of an infected mosquito. The mosquitoes that are known to carry the virus include 2 Aedes species mosquitoes, which can be found throughout the world. When a mosquito bites a person who is already infected with the Zika virus, the virus infects the mosquito. Then, when the infected mosquito bites another person, the virus enters that person's bloodstream and causes an infection. During pregnancy, the Zika virus can also spread from a mother to the fetus. The virus can also spread from one person to another through sexual contact. In some cases, people contract the virus through blood transfusion or organ donation. Factors that put you at greater risk of catching the Zika virus include living or traveling in countries where there have been outbreaks. Being in tropical and subtropical areas increases your risk of exposure to the Zika virus. Especially high-risk areas include several of the Pacific Islands, a number of countries in Central, South and North America, and islands near West Africa. Because the mosquitoes that carry the Zika virus are found worldwide, it's likely that outbreaks will continue to spread to new regions. Most cases of Zika virus infection in the U.S. have been reported in travelers returning to the U.S. from other areas. But the mosquitoes that carry the Zika virus do live in some parts of the United States and its territories. Local transmission has been reported in Florida, Texas, the U.S. Virgin Islands, and Puerto Rico. Women who are infected with the Zika virus during pregnancy have an increased risk of miscarriage, preterm birth, and stillbirth. Zika virus infection during pregnancy also increases the risk of serious birth defects in infants. Congenital Zika syndrome, including a much smaller than normal brain and head size, microcephaly, with a partly collapsed skull, brain damage and reduced brain tissue, eye damage, joint problems, including limited motion, reduced body movement due to too much muscle tone after birth. In adults, infection with the Zika virus may cause brain or nervous system complications, such as Guillain-Barré syndrome, even in people who never show symptoms of infection. There is no vaccine to protect against the Zika virus. But you can take steps to reduce your risk of exposure to the virus. If you or your partner is pregnant or trying to get pregnant, these tips may help lower your risk of Zika virus infection. Plan travel carefully. The CDC recommends that all pregnant women avoid traveling to areas where there is an outbreak of the Zika virus. If you're trying to become pregnant, talk to your doctor about whether you or your partner's upcoming travel plans increase the risk of Zika virus infection. Your doctor may suggest you and your partner wait to try to conceive for 2 to 3 months after travel. Practice safe sex. If you have a partner who lives in or has traveled to an area where there is an outbreak of the Zika virus, the CDC recommends abstaining from sex during pregnancy or using a condom during all sexual activity. If you are living in or traveling to areas where the Zika virus is known to be, take steps to reduce your risk of mosquito bites. The mosquitoes that carry the Zika virus are most active from dawn to dusk, but they can also bite at night. Use insect repellent. You can apply permethrin to your clothing, shoes, camping gear, and bed netting. When used as directed, these repellents are proven safe and effective, even for pregnant and breastfeeding women. In some cases, the Zika virus has spread from one person to another through blood products, blood transfusion. To reduce the risk of spread through blood transfusion, blood donation centers in the United States and its territories are required to screen all blood donations for the Zika virus. If you had Zika, or if you live in the US and recently traveled to an area where the Zika virus is widespread, your local blood donation center may recommend that you wait 4 weeks to donate blood. Thanks for watching. Don't forget to subscribe.